Up. Now, Monday was the World's Malaria Day. The Ministry of Health aims to scale the uptake of the malaria vaccine among children aged between 6 months and 14 years. The vaccine has seen a significant decline in the number of infections among children, especially those from the 8 endemic counties. This comes as malaria is estimated to cause 260,000 deaths of children under age of 5. Now, as Kenya commemorated the World Malaria Day in Kakamega County, the Ministry of Health pledged to set aside 800 million shillings in the fight.
Kenya's malaria prevalence has reduced by 50% in the last decade. This is according to the Ministry of Health, which further says that the disease burden within the lake endemic zone has significantly declined.
Despite the high prevalence in this region, the region collectively at 19%, we recognized that there has been a significant drop in the malaria disease burden, which was 27% in 2015.
Malaria prevalence in Kakamega County has reduced from 38% in 2015 to 15.2 in 2020. This is according to the Kenya Malaria Indicator Survey. Malaria incidences has reduced from 438 cases per 1,000 population in 2015 to 295 per 1,000 population in 2021.
But while this is the case, more still needs to be done in the control and prevention efforts so as to fully eliminate malaria by the year 2030. According to Africa CDC, there is an estimated 3.5 million new clinical cases and 10,700 deaths each year, with the Western Belt and Nyanza region having a high prevalence burden for the disease. Further, at least 260,000 children under the age of 5 die from malaria. Some of the affected counties include Kisumu, Kakamega, Busia, Vihiga, Bungoma, Siaya, Migori, and Homa Bay. With this year's celebration theme being Tumalize Malaria, Tuimarishe Jamii na Usawa kwa Wote. The introduction of the malaria vaccine, introduced in phases in 2019 in Kenya, Malawi, and Ghana, continues to play a key role in the fight against malaria. Since then, more than 750,000 doses of the vaccine have been administered to children in 8 endemic counties. 275,000 Kenyan children have received at least 1 out of the 4 scheduled doses of the vaccine, while over 45,000 children have received the entire course of the 4 doses.
The Ministry of Health will scale up the malaria vaccine to all sub-counties in Kakamega and in the malaria endemic lake region by June this year.
Those eligible for the vaccine are now children aged 6 months to 14 years. The ministry has further allocated 800 million shillings to boost the fight against malaria in the country. Helen Aura, NTV.